Is a quarterly series of Forward Montana, but for this particular series we have had quite a few sponsors, the Center for American Progress being one of them, as well as Montana Women Vote and Students for Choice and Students for Economic and Social Justice. So thank you for all the sponsors this evening. And now I'd like to get the crisis started. So, it's been a while. So tonight we have a panel of experts here that are going to talk to you about the healthcare issue nationally and the crisis currently. So to start off, I'm going to introduce Mayor John Engen. While we all know him and his good jokes, so I'm just going to pass it over because he's a great guy. Here you go, John.
Well, thank you very much, Lynette. Just a couple housekeeping items. This is titled The Naked Truth, America's Healthcare Crisis. For those of you who are expecting nudity, it's not actually going to happen this evening, so we'll give you some time to leave. Okay, good. Everyone's here for the right reasons. I'm glad to hear that. Well, ladies and gentlemen, it's a privilege to be here with you this evening. I'd like to thank the folks who are sponsoring this evening's event, including the good folks from American Progress. Ladies and gentlemen, the American Progress Action Fund is the sister advocacy organization for the Center for American Progress. Every day the Action Fund challenges conservative thinking that undermines the bedrock American values of liberty, community, and shared responsibility. The Action Fund transforms progressive ideas into policy through rapid response, communication, legislative action, grassroots organizing, and advocacy, and partners with other progressive leaders throughout the country and the world. We'd also like to thank Forward Montana, ladies and gentlemen. Forward Montana exists to build a youth-directed, long-term grassroots organization that harnesses the power of cultural and peer-to-peer outreach to train, mobilize, and elect a new generation of progressive leaders in Montana, and we need that. Nice work, folks. Students for Choice empowers students to make informed reproductive, that's quite all right, and sexual health decisions, and to participate in the process that shapes our reproductive choices, rights, and freedoms. The good folks at Montana Women Vote. Montana Women Vote is a coalition of 10 nonprofit organizations that work together statewide to encourage women, in particular lower income women, to participate in the democratic process. Montana Women Vote focuses on issues important to women and their families, such as economic security, domestic violence, human rights, healthcare, reproductive rights, and environmental health. And of course, last but not least, Students for Economic and Social Justice, ladies and gentlemen. SESJ promotes economic and social justice on campus and abroad. Yeah. Well, thank you again, ladies and gentlemen, for joining us this evening. As mayor of Missoula, I often tell folks that I work for at least one billionaire, folks who sleep in their cars, and all kinds of folks whose circumstances are somewhere in the middle of that spectrum. Our system works pretty well for the billionaire. And I think in some cases, it even works for some of the souls who are homeless and helpless, as it should. But there's a whole bunch of those folks in the middle working Missoulians, raising families, making the mortgage, paying the gas bill, topping the gas tank, keeping kids in sneakers and groceries, filling offering plates, or supporting a charity. Folks in the middle, for whom a $600 a month healthcare premium is an impossibility, and for whom a serious medical problem is a physical and financial catastrophe. Tonight I have the honor and the privilege of introducing folks who pay careful attention to our nation's healthcare crisis from a variety of vantage points, from the halls of government to waiting rooms in clinics. I look forward to hearing and learning from them and joining in the conversation about finding solutions to this crisis. With that, highly organized mayor, who apparently needs bifocals. I'll get better, I promise. Ladies and gentlemen, it really is an honor this evening to join you all in welcoming Senator Tom Daschle, a distinguished senior fellow you'll learn more about soon. Senator Daschle is a distinguished senior fellow at the Center for American Progress. Senator Daschle's work for the center focuses on healthcare policy, global economic security, and health issues. The senator is also a member of the Global Alliance's Steering Committee, an international coalition of progressive leaders dedicated to the development and exchange of progressive policy ideas. In addition to his work at the center, Senator Daschle is also a visiting professor at Georgetown University's Public Policy Institute, conducting student seminars, guest lectures in classrooms, and holding public discussions related to politics and policymaking. Elected to the U.S. House of Representatives in 1978, Senator Daschle served there until 1986, when he was elected to the United States Senate, ladies and gentlemen, from the great state of South Dakota. He became minority leader of the Senate in 1994 and the majority leader in 2001. He was the second longest serving Democratic leader in history. Senator Daschle now serves as senior policy advisor in the Washington office of the law firm Alston and Bird. Senator Daschle attended South Dakota State University, nice state university, and graduated in 1969. He served for 3 years as an intelligence officer in the U.S. Air Force Strategic Command. Ladies and gentlemen, for a kid from 2nd Street who grew up learning from his dad that FDR was a god, I'm pretty happy to introduce to you Senator Tom Daschle.
Thank you. Thank you. Mayor Reagan, thank you very much for that generous introduction. You have a fantastic mayor. Do you realize how good a mayor you have? What a great turnout. This is so good to see this many young people here to talk about such an important issue. I was thinking as I came up of an experience that I had many years ago in South Dakota. At a meeting a little bit like this, it was at a bar in South Dakota, which oftentimes in our smaller towns is the only meeting space you've got available. And I think the bar had opened around 8 or 9 o'clock in the morning, and there had been a couple of people who had been there right at the bar most of the day, and we were meeting in the back. I knew there was trouble when they came into my meeting. One of them yelled out, "Daschle, I want to know the difference between a Democrat and a Republican." Well, he was obviously, he'd been quite inebriated, and I said, "Well, when you sober up, I'll tell you." He said, "When I'm sober, I don't give a darn." So I know that you're Republicans and Democrats perhaps, but you're here for a progressive cause, and I want to thank Forward Montana, the Center for American Progress, and all of our sponsors for making this possible. I know that tonight there are 2 or 3 people in the room who are here to register you. If you're not registered to vote, you can vote from home. And I'm hoping that anybody who isn't registered Could those who have the ability to do that raise their hands so you know who they are?
The deadline was 5 o'clock today, but you can do same-day registration at the courthouse, and I can tell you how.
Okay, you can register at the courthouse, and somebody there that can, in the back of the room, can tell you how. Let me say as well how pleased I am to be with the man on my left. Pat Williams and I came into Congress together, and a little known but a very, very important fact. He's the only member of Congress who chaired a committee that actually passed out national health care reform all the way back in the early 1990s. And that's just one of the fantastic things that Pat Williams did as our congressman. And I'm very, very grateful. And the majority leader of the state Senate is here, Carol Williams, and I just want to make sure she's recognized. She's a leader here in Montana in more ways than one, and I'm delighted that Carol could be here as well. But you've never sent a finer member of Congress to Washington than Pat Williams, and he's been a dear, dear friend of mine for a long period of time. But I want to thank Mary and Rochelle as well, and I'm looking forward to our opportunities to talk about this important issue tonight. The fact is that our healthcare system tonight is totally broken. We live under a myth that we have the finest healthcare system in the world, and I must say, regardless of what criteria one looks at, that couldn't be farther from the truth. And the people most affected by that very fact are the people in this room tonight. What people don't realize, first of all, is that we pay $6,000 in taxes, premiums, and out-of-pocket expenses per capita in this country for the health care we get. That is 40% more than the second most expensive country in the world, Switzerland. 40% more. And even though we pay $6,000 per capita, the World Health Organization last year ranked us 28th in outcomes performance, in overall quality. We're 41st in life expectancy, 37th in infant mortality. Can you imagine what it would be like if the Olympic team for the United States came back 37th or 45th? What would we say about that team and what we're going to do to change it over the course of the next 4 years? Our quality is as bad as it has ever been, and it's actually getting worse, not better. And you add to that 46 million Americans who have absolutely no health insurance at all. And you begin to appreciate the magnitude of the problem we're facing. We're the only industrialized country in the world that doesn't have some form of national health care today. It's a tragedy, it's an embarrassment, it's one of the single most compelling problems that our country is facing, regardless of circumstance. And so the question is, why is this important to young adults? Well, it's important to young adults for a lot of reasons. I happen to believe that this issue is as important as whether or not you get a diploma from college. Because it will affect the quality of your life every bit as much as any degree you'll ever get, regardless of how many you get over the course of your time in higher education. There's a woman who's named Michelle Morris. She was the subject of a story in the National Journal last spring. A college student who had colon cancer. She really needed to enter a hospital and be treated for her, at that point, not yet terminal disease. But her insurance company said, if you go into the hospital full-time, we're going to drop you because under our contract with your parents' insurance plan, you have to be a full-time college student in order to be eligible to get health care. She tried to stay in college at the full-time status level, went at night to get treatments for her colon cancer. Ultimately, because she couldn't do both, she stayed in school for fear of bankrupting her parents, and she died at the age of 23. Now that could happen to anybody. If you're healthy today, you won the gene pool so far. But what's in it for young adults? Well, first of all, I'd say that 2 out of every 5 young adults, and I would guess that this room is probably just the same as any other cross-section of young adults anywhere in the country, 2 out of 5 of the people in this room don't have health insurance today. And what's really troubling about that is that 40% of those who don't have health insurance pass up getting any medical care when they get sick. And guess what happens? Things get even worse. And like Michelle, sometimes they die. 3.5 million young adults are pregnant. 20,000 young adults get cardiac problems every year that require major surgery or some form of intensive care. 20,000. But it's not just a health issue, it's an economic issue. I recently attended a conference where they said, on the average, if you take what you pay in taxes for health care, in out-of-pocket expenses for health care, as well as in premiums for health care over the course of your lifetime as a young adult, I'd like to ask you to guess what you're going to pay overall in a lifetime. You know what the answer was, according to the experts I heard the other night? $1 million. You'll pay $1 million for your health care over the course of your lifetime. And the question is, what are you going to get for it? And it's not just how much you're going to pay. It's what kind of job you're going to have. The other day, a couple of months ago now, I was at Berkeley. I was speaking to one of the members of the Berkeley board who happens to be on a lot of other boards. He said, Senator Daschle, we just made a very, very difficult choice. And it pains me to say this, and I'm embarrassed. I voted the right way, but the board voted the wrong way. We had a choice of 2 locations to put a 3,000-person plant, Canada and Alabama. He said, my board chose Canada. And you know why? Because they have national health insurance in Canada. They don't have it in the United States. We're losing jobs because we don't have the kind of national health care system that would allow us to be competitive with other countries today. And more countries or companies are going abroad because they don't want to have to pay the costs employers are paying today here in our own country. So it affects you as dramatically and as consequentially as anybody today in the country. The real question is, what do we do about it? Well, I believe that it is imperative that over the course of the next couple of years, we as a country demand of our political leaders that this be one of the single most important issues that we face in the new Congress and with the new administration. We can't afford to allow this to go much longer and continue to face the problems that I've just described for you. How do we do it? Well, first of all, I think we have to break the myths. Contrary to popular opinion and belief, we are not the country with the best healthcare system in America today. The problems that we're facing with regard to outcomes even affects the billionaires that Mayor Engen talked about. And unless you can go to a place like Mayo Clinic, you have to be concerned about the quality of care you're getting regardless of what circumstances you may be facing. So let's destroy the myths, first of all. Secondly, let's step up to the plate and say, we're not going to elect leaders unless they commit to changing our current system. And we're going to ask every politician, what are you going to do about it when you get to Washington? What are you going to do about it when you get to the state capitol? Are you going to fix this system? And how are you going to do it? The third thing I think we have to do is to recognize that it's important we think out of the box. I don't think we ought to look at our healthcare system in the current context. We have to look at it comprehensively. We can't simply deal with one segment of the population or one particular problem. We have problems with regard to administrative costs. We spend about 25%. 1 out of every $4 that we spend in healthcare today goes to paperwork and bureaucracy, not to healthcare. So we can't just change that and not have other problems down the road. We've got to change it all, and it takes a comprehensive system to do it. So we have to think out of the box and think comprehensively, not selectively. The second thing we have to do is to come up with a new paradigm. I happen to believe, and I'm not wedded to this, that the Federal Reserve model is a pretty good model for healthcare. It's worked in our banking infrastructure. You have a regulatory system that allows the private sector to work pretty well. I think we could do that in healthcare with a federal health board that would allow us maximum coverage, universal coverage, good containment of cost, and a far greater degree of quality control than we're facing today with something we call best practices. And we won't get into the weeds too much with that. But that's the kind of thing we have to do. So tonight we're going to talk about that. I'm lucky to be on the stage with three people that know a lot about this issue. And I look forward to your comments and questions. Let me just end with this wonderful story that I know Pat has probably used as well, but I love to tell it. It's about a room about this size, actually, in Philadelphia. Constitution Hall was right there in the middle of the city when our founding fathers were trying to decide what kind of country this was going to be. And every night, a crowd would gather outside the hall for whatever news had been created out of the decisions made that particular day. One night, late in the night, Ben Franklin was leaving Constitution Hall, and a woman from the crowd yelled out, "Mr. Franklin, tell us, what will it be? Have you decided, will this be a monarchy or will it be a republic?" He thought for a moment and yelled back to the woman, "Ma'am, it'll be a republic if you can keep it." Well, that's really been our challenge for the last 225 years, keeping this republic. But I have to say, we can't keep the republic with the vision that our founding fathers had and say no to 46 million Americans who don't have health insurance, and say to Michelle Morris's family, it's just too bad she got colon cancer, but there's nothing we can do. Or say to people right now who simply don't have the means to pay their bills and have to declare bankruptcy that economic humiliation is just part of living in America in the year 2006. I don't accept that. And whether or not we keep it depends in part on whether or not we solve this problem. Thank you all very much.
Tom Daschle's in Missoula, Montana this evening. So Pat Williams served 9 terms, ladies and gentlemen, in the United States Congress as a representative for the great state of Montana between 1979 and 1997. He served more consecutive terms in the House than any other representative from Montana, and as a member of Congress, Pat chaired the Subcommittee on Labor Management, which had jurisdiction over the Clinton administration health care bill. Ladies and gentlemen, in the same way that my dad had FDR as a political hero, Pat Williams is mine. The difference is I've had the opportunity to meet him, spend a little time with him. He's the real deal, ladies and gentlemen. When he was in Washington, D.C., he was the nation's Pat. For a while, he was Montana's Pat, and I'm really proud to claim him as Missoula's Pat. Pat Williams, ladies and gentlemen.
Thank you. Thank you. Thank you, Your Honor. I'm so glad you all brought Tom Daschle to Montana, because Tom and I haven't seen each other for a dozen years. And we were able to spend a couple hours together reminiscing, and it was one of the really fun moments of my life, Tommy. Thank you. Now, Tom and my friends, the groups that are sponsoring this are not political, but I am. And when Tom asked, when he laid out those really horrendous problems, a few of them, laid them out very well, about the healthcare dilemma in America, he asked this question: what are we going to do about it? Well, Tom, Montanans have got one answer. Come November, we're going to change one of our United States senators. Come on now, you're non-political, stop it. It was 13 years ago that my committee tragically became the only committee in the Congress to pass out a plan similar to the Clinton plan. We revised the Clinton plan, put a little more coverage in it, created what we thought was a little more equity for folks, particularly at the bottom, and passed it out. And then for good measure, just to test ourselves, we also passed out a single payer plan right on top of it. And then for a number of reasons, which we're probably better off not to go into tonight, it didn't pass. And that was the problem. That was a problem caused primarily by America's healthcare insurance companies, the far right, and unfortunately, a handful of Democrats in both the House and Senate who joined those, what I think are dark forces in American political life. And so here we are a decade and a half later, and we have now entered, make no mistake about it, we have entered a crisis in healthcare in the United States. The effectiveness of our physicians is being reduced. The quality of our hospitals is being diminished. Our medical research is no longer the unquestioned world leader that it once was. America's business and industry are having trouble being world competitors. One of the reasons, only one, but one of the main reasons why America's once powerful, grand automotive companies are starting to go under is because of their healthcare costs and the fact that they can't compete in price with other companies that make automobiles because those other nations have national health care. Our healthcare system, with regard to paying for it, the insurance for it, the coverage, financial coverage of it, is a disgrace that is now becoming dangerous to everyone in this room. Costs are climbing, and they will, before most of you reach middle age, be beyond your ability to afford them. Count on it at the current rate of doubling inflation and more every year. That's what healthcare costs are doing. They're going completely beyond your wallet. There are more uncovered people in America, uncovered, than any place else in the civilized world. In this country. It's disgraceful. And it's dangerous. Here's one of the ways it's dangerous. Just a few days ago, the head of the American Cancer Society said this: lack of health care in this country is about to become a larger threat to cancer than is tobacco. Look, We're too good as a people. We're too innovative. We're too damn smart to let the forces of darkness continue to make this the only country in the world that can't face up to its healthcare dilemma. And you know what? People Tommy and my age aren't going to be able to change it, but by God, you can. Now you go do it.
I love it when he's apolitical. So our next speaker, ladies and gentlemen, Raquel Castellanos. Raquel was in my office 2 months ago now, probably. And I'll give you a little biographical information in a moment. Raquel was in my office with an interesting question. Or maybe it was an answer, I'm not sure. A dilemma at best. Mayor, I don't know what you can do about this, but I gotta talk to somebody about this. I gotta talk to you about who's not getting served, how they're not getting served, when they're not getting served, and how I'm gonna continue to serve them. How am I gonna do that? And the mayor of the city of Missoula didn't have any bright ideas at the moment. Still don't have that many bright ideas, but did remind her that the door is always open, we can always talk, and maybe, just maybe, we can put enough heads together to figure out some of these things. This is one of the steps in the right direction. Raquel is relentless and passionate, and her career reflects that. After moving to Missoula in 1992, she decided to go for the big bucks and went to work for Word, a feminist nonprofit organization. Raquel worked as a case manager with single mothers struggling to nurture children in our economy and in the jobs program. She served as co-director and founder of WHEEL, that's Working for Equality and Economic Liberation, ladies and gentlemen. And now, today, serves as the executive director of the Blue Mountain Clinic. Raquel is in the waiting room and on the front lines every day. This is a quote from a biography she sent along. In the past 3 years, I've seen the impact of the national healthcare crisis hit our community. Only a few healthcare providers in Missoula currently accept new Medicaid and Medicare patients. As a result, Blue Mountain Clinic has risen to meet the growing need for access to health care. On the other hand, no one's given Raquel a whole lot more money to take care of business at the Blue Mountain Clinic. I'll let her tell you more. Ladies and gentlemen, a woman with passion and respect for the people she serves, Raquel Castellanos.
Test my mic. First of all, I want to say that when I was asked to speak, I was incredibly honored and humbled because Pat Williams has always been a hero of mine, and as has his wife, Carol Williams, so I was honored that I would be on a stage speaking tonight. And then I heard that it was a focus to young people, and I think back to when I was graduating from college and saddled with my debt from going to the University of Southern California. I got 18 credits in 2 years because I had to get the heck in and get out, get those student loans to a minimum. And I didn't think that I'd be in the position I am now, but I'm looking at all of you who are young and looking to your futures and the crises that we have to solve as a society, and healthcare is but one of them, but I think it is a significant one. When I was hired at Blue Mountain Clinic as the executive director, my learning curve was pretty steep in terms of healthcare and the healthcare crisis, and I did not have a looking glass that would have shown me what I learned in the last 4.5 years, and it's been astonishing. When I came into the clinic, we were and have been a full family practice. We started out as a homegrown community organization that started to serve women with reproductive health care after Roe v. Wade was passed. We were the first abortion clinic in Montana, and I'm very proud of that history and legacy, because the feminists in Montana and the community had come together to meet a need that was not being served in our community. And Blue Mountain Clinic turns 30 years next year, and we continue to stand up and meet the needs of people in our community. And so as we've evolved, what happened was, when I came onto the scene, to the clinic 4.5 years ago, we were serving and still serve about 11,000 patient visits a year here in our community. And these are not all folks who come just from Missoula. These are folks who come from outlying rural communities, Superior, the Bitterroot. Boy, we have people come from all over the state, I'll tell you. And there's some significant things that I've learned along the way on this journey as the executive director. And one was that we were doing okay. We were plugging along as a small little community organization. And it was because of the support of Missoula and the fundraising and those $25 and $100 gifts that come in every year that made it possible for us to serve people. So we were doing okay. Well, 2 years into my time there, we got hit with a huge malpractice crisis. And in 1 year, the cost for our malpractice insurance went from $17,000 a year to $36,000, which meant that we had to fundraise that difference. What I learned, and I went to find experts and helpers, and there's a wonderful gentleman in town, Larry Riley. I want to say that he is has been a mentor and a true helper to me in trying to understand the healthcare crisis and the role that malpractice insurance plays in that for providers. What I learned was that all of the providers in Montana were getting hit with these rising costs of malpractice insurance. And yet our reimbursement rates from insurance companies continue to shrink. And so when we serve patients, we get reimbursed less and less, and yet our costs to serve those patients and have insurance continue to rise. And it's an incredible financial pressure that physicians and providers are under. You know, my understanding after that year of crisis, that next summer, so this is the summer of '05, the summer of '04, I had one of my physician's assistants come into my office and say, Raquel, I'm getting all these people coming in here with little children, with pediatrics, telling me that they're in here for the first time and they could not find a doctor to take their children to. They are on Medicaid or they are low income, and there was no doctor in town taking new pediatric patients. These are our kids who need immunizations, who need well child checks. We all know that when children have those early years of health care, the prevention that and the work that does in later years is phenomenal. And so Blue Mountain Clinic had stepped up. We said, well, we're going to keep taking these patients. And then all of a sudden I got hit with more and more stories. Clinicians coming to me telling me, I'm getting all these elderly folks on Medicare. And the front desk telling me, we're getting all these phone calls from people saying, I can't find a doctor to take my care. No one is taking new Medicare patients. And so Blue Mountain Clinic has continued to step up and meet that need. And as I continue to try to figure out how am I going to hold this ship together, of course, the one factor that does keep us going is the generosity of the Missoula community and the Montana community. Without fundraising, we cannot make this fly. So I started looking for models, and I very naively called Dr. Steve Seninger at the University of Montana School of Business, and he's a health economist. And I said, gee, I just need some business models. There's got to be a business model out there that I'm missing. I was a philosophy major, not a business major, so help me out here. How can I make this boat float? How can I keep serving the people who are coming to us and meet the exponential costs that are rising? And he just looked at me and said, Raquel, I don't think there's another clinic in the United States like yours. So that's a tribute to Missoula, Montana. I want to say we step up and we help our community and we help our people. But we can't keep it up. I mean, we've got to continue to fundraise. We've got to continue to meet that growing need. And I don't think that one little clinic in Missoula, Montana can solve this national healthcare crisis. But what we're seeing is the impact of that crisis on our community. And we have amazing staff. It is on the dedication and the willingness of our staff to work for really wages that are well below what they could get paid anywhere else, that we make this fly as well. So it's fundraising and it's a very dedicated staff to our mission. Our doctor, Dr. Rabbits, told me a story, and I know I only have 10 minutes, but I'll make it as quick as I can. He was an Army doctor, and he has practiced for, I believe, about 28 years all around the country. And when he came to Montana, his wife is a native from Montana, they moved here, and he said that he had practiced all over the country. And until he got to Missoula, Montana, he had never seen the level of progression of diseases that are preventable. Simple diseases, like a thyroid disease, where the medication is not that expensive, and that it is a preventable disease. He had never seen, other than in textbooks or when he was teaching in medical school, people coming in with a disease that had progressed to the point that it had, where there's no turning back, because those folks did not have access to health care in the early stages of a disease that is very treatable, that is economically preventable and treatable. And he had never seen anything like that since he had worked in rural Georgia, in a very poor area of rural Georgia. So the healthcare crisis in Missoula has hit, the national crisis has hit home. It's hit Missoula. And again, when I tried to look for other clinics like ours around the country, I found that there really aren't any. We are a very rare and very precious gem here in Missoula. And but we're going to need to look at national policies in order to continue to provide the level of services, because we cannot continue to just exponentially. I wish I had a money tree, but it doesn't exist. And there is such competition in Missoula. There are so many great nonprofits that do so much good work to help the people in Montana. Montana has one of the lowest wages, medium wages in the country. We have so many economic issues that we're working on and dealing with, and there's so much pressure on those who do fund the work we do. And so we do need national leadership. And recently we held a leadership breakfast with legislators. Kate Bratches from Partnership Health Center and I got together and said, we really need to let these legislators and policymakers know what's happening. People are not getting access to health care. And we were looking around and going, where is the leadership? And I was very pleased to be invited and to hear that this was happening today, because we were really racking our brains about where nationally, who is the national leader that stands out other than Hillary Clinton on healthcare issues. And so it is time for us to stand up, and it's going to have to be a grassroots movement. It affects each and every one of us. And I'm just pleased to tell you about what's going on here in Missoula. I'm sad that it's going on, but we need to know that it's going on. That there are people here in our community who have programs that we pay for through our tax dollars. And even though those safety nets are there, if they can't find a doctor to get into, then they don't have access to health care. Thanks.
Thank you, Raquel. So Lynette gave me the job of keeping people brief. I got the look from Lynette, but I was more afraid of the look I get from you if I stopped you. So I think we found a perfect balance here. My humble opinion. Thank you very much, Raquel, for your passion again. Mary Cafaro is the Executive Director and Policy Specialist for the good folks at Wheel. Her story is this: a mother of 4 children, Margaret, Haley or Hallie? Haley, Joseph, and Kenji Swain. The Swain Cafaro family joined Wheel in 1999 as a welfare family, fighting for their right to access education. For a short period, Mary was on the Wheel board before resigning for a Vista position with Wheel. Advocacy was Mary's Vista project until becoming the organizer advocate in 2002, and since that time she has shifted roles from policy specialist to executive director with a short leave of absence, ladies and gentlemen, to serve a term in the 2005 Montana legislature. Thank you for your service there as well. Mary Cafaro, ladies and gentlemen.
Thank you for having me. I appreciate being here. I'm not really a policy wonk, techno person, but I was asked to frame up solutions, and the only way I could do it was with this PowerPoint. I hope you can see it, and if not, I am happy to give you copies. I have information about Wheel over there on the radiator, including a sign-up sheet, so if you're interested in working on this exciting healthcare policy during the legislature, or you just want more information, please sign up. We have our pamphlets over there too. In 2005, when I took my oath as a legislator, something happened to me. I became insured for the first time in my adult life. This first slide says profits or patients. We really don't believe you can serve 2 masters, and that's the problem with our system in the United States today, is that we serve profits over patients. We believe that healthcare is a human right, and I think everybody really does believe that, and if they insured or not, you believe that. And if you didn't, you wouldn't go to the emergency room when you had that heart attack. Oh, see, this is the first time I've done this, by the way. In order to do something about our healthcare system, our current healthcare system, we need to have a few principles in place. One is healthcare is a public good, just like fire safety, like the police force. When you are having someone break into your house, you call the police. Do you stop and think, do I have my insurance card with me? Does a police officer say, before I can serve you, I want to know if you've paid your deductible? No. Healthcare is the same thing, just like roads and safety. It's a public good. Second, we need healthcare for everyone. Everybody in, nobody out. One pool, we share resources and we share risk. In order to do that, we need to be smart with our spending. Dr. Steve Senninger did a survey in 2003. What he did was he went out and surveyed the uninsured business owners, uninsured farmers and ranchers, uninsured women and men, children, all across the political spectrum. All kinds of things came out of those interviews and those surveys. 3 main themes emerged constantly. Number 1, the current health insurance costs too much, and the current system is broken and can't be fixed. And in one way or another, we need universal health care out of the mouths of the uninsured. If you want the solution, ask the people impacted by the problem. So here is one model, the single payer model. And this is what we promote. This is from Vermont, and it does exactly what Senator Daschle said, and then Congressman Williams. Did I get that right? I know who they are, I really do. You pool all the money, Medicare, Medicaid, employer payroll tax, employee payroll tax. Remember, people no longer are paying premiums, employers are no longer paying premiums, but instead they pay these 2 taxes, pool the public health dollars, put it into one big fund, and pay directly for care. No middleman, no insurance company. 2003, Medicare spent $260 billion, Medicaid $160 billion, $140 billion subsidizing private purchase of health insurance. So when I said we need to be smart with our spending, we need to be smart with our spending. There's a lot of policies out there that are floating around where you take tax dollars and you pay for private insurance, number one. Or you give a tax break to people to help them offset the cost of their insurance. Same principle with business. Problem with it is it's not smart and it's not efficient. An MIT study shows that tax subsidies cost the government between $2.36 and almost $13 per $1 of value. That's not a good deal for taxpayers. Then this slide goes along with what Tom Daschle said. The yellow bar is just the money we spend our taxes on to provide health care. That's just tax-sponsored health care, so it could be public employees, it could be Medicaid, Medicare, CHIP, IHS, VA. That's what we spend. Just our tax dollars alone, we're spending more than any of these other countries. We're already paying for universal health care and not getting it. It's not a good deal for taxpayers. And look at that, you know, over $5,000 we spend per person in this country, and we have 36 million people uninsured. Why do we spend more and get less? Because we don't spend smart. We spend too little on prevention and primary care when it costs the least. And we spend a ton on administration. Our current system is not a good deal for patients. As Raquel said, access is a problem. What this shows is that access is a problem for everybody, whether you have insurance, don't have insurance, or you have public coverage. After people left the ER, 63% with private insurance and the ability to pay in full were able to access their follow-up care. So that means that 27% of people who have insurance couldn't access the care they needed. 34% of individuals with Medicaid and 25% of the uninsured. So insurance coverage does not equal access. I keep getting my buttons mixed up. The other problem with the current system is that it's based on market principles, and they don't fit with healthcare. We're not selling cars here. It's health. It's healthcare. It's a necessity. So when people went to try to make their appointments, 70% of the clinics did not try to determine the severity of the caller's condition. 98% did screen for the source of pay. So they're more interested in how you can pay than what your condition is. And insurance doesn't cover the costs. It doesn't provide the protection or security. Over 50% of people who file for bankruptcy file because of a medical condition. So again, over 50% of people who file for bankruptcy file for a medical condition. And out of that, over 50%, 76 had insurance at the time of the illness. So insurance is not providing what it should be providing for the insured. What are we getting for our spending? Well, let's say, what are they getting for their spending? Remember the country that spends the most on healthcare? The United States. Canada spends way less than the United States, but their outcomes are much better. I was so unaware that anybody still died in childbirth, I couldn't believe the statistic. Canada has a third less of their moms dying in childbirth than the United States. So you can say what you want about Canada and their system, but their outcomes are better than ours. Another thing, what is the impact of our current system on providers? Providers and patients. Remember, who provides the care? Not the insurance administrators, not their layers and layers of caseworkers who work to try to deny you care. Physicians provide care. 2,500% growth of administrators since 1970. And I don't even know what that line says of the growth of physicians, it's so low. then again, the people who are providing primary care are not filling the residencies. So that's your general practitioners, internal medicine, pediatrics, obstetrics. They're going down. They're going down. And in Montana, talk about administrative costs, costs not going to providing care, costs not transferring from a patient to a provider, but to the administrators, coders, billers, caseworkers, all of that. 1.5 billion in Montana of our healthcare dollars didn't go to providing care. So again, part of the solution needs to be to save money. If we just cared for everybody, we would save 65 to 130 billion. And if we simplified administration and again paid for care rather than for profits and all that other stuff, we could save almost 300 billion, according to the Institute of Medicine. Following on someone else's story, if GM can't bargain for affordable health care, how can a sick patient? People who are uninsured pay more than the insured, because the uninsured, many of the uninsured do pay their bills, but they pay 100% of costs. They don't have an insurance company going in there and negotiating down their prices. In Montana, again, what's the impact on business? You know what a great economic development tool would be? Single payer. Then our business owners wouldn't be burdened with trying to come up with the money to pay for insurance, and more money could go into their businesses. This is another study by Dr. Steve Senninger. In the past 3 years, 77%, employers saw a 24% increase in their premiums for their employees. They couldn't afford it, so the cost shifted to their employees, which resulted in a 77% increase for employees. Another thing that came out of Dr. Senninger's work is that employers feel awful about this. They can't afford it. They can't afford it. They cannot afford to provide health insurance for their employees, and they feel terrible about it. And they shouldn't have to feel that way. What about workers? Okay, well, you can see here over 70% increase in the past 6 years in insurance premiums. Well, wages went up about 22% in the same time. Again, it's unaffordable, and a solution has to do something about that. In Montana, the average family pays almost a third of their wages. And our children, the employer-sponsored insurance is not helping our children. Montana has 37,000 children who are uninsured. Out of that, over 90% come from homes with working parents. So employer-based insurance is not cutting it for our kids. In Montana, if we took all the uninsured kids and had them stand hand to hand, they would string out a line 27 miles long. Back to the solution, a single-payer healthcare system where all the money goes into one pool and then goes out to pay for care. It's really simple. It's not complicated. The problem is the politics. This is really interesting. So it kind of seems backwards. If we cover everybody, we're going to save money. You bet we are. The three top scenarios are all different. One is employer-based. One is where you carve out different populations and cover them. And the other one is public. Number 4 is universal health care. So if we enacted a universal health care system, single payer, in the first year we would save $25 billion and cover everybody. This guy, does anybody know who this is? I didn't know who he was. He is the father of the current healthcare system in Canada. And I'm not sure when it started, but it's been a long time ago. They had a recent poll in Canada to see who's the most popular person in the country, and he won. And that hockey guy, Wayne Gretzky, he came in 10th. I love their values. I absolutely love the values. But he started the healthcare system in a province. Canada didn't start the whole country at once. And so when people say it needs to be a national solution, I say, bullshit. Then again, just my information. And like I said, we brought pamphlets over there about WHEEL and sign-up sheets if you want more information or would like to get involved. Thank you.
I can't imagine there'd be any questions from this group. Huh? A few? Lynette, how much time do we have for questions?
10, 15 minutes.
10 or 15 minutes, so, okay. Who'd like to start, sir?
I have a question, Mary. So I'm just wondering about the political feasibility of your plan in Montana. It certainly seems at the national level that would be pretty hard to do, given certainly the people we have now and possibly even the people that we'll get in November. What's your read on local politics?
So are you asking me if we have the political will in Montana?
Yes.
Okay, maybe not right now, but that's what we're working on. For one thing, I don't mind incrementalism as long as it moves towards your goal. So for example, the expansion of CHIP, it moves towards the goal. The goal is to cover everybody, so you keep covering kids and then pretty soon you cover adults and you get to the goal of covering everybody. I'd like to be there tomorrow, but it's a big change to ask people to do. So I think we just keep moving step by step, keep educating the public. Once people understand this, the economics of it, there's more support. So it's a big public education piece. I don't think political will needs to be a criteria.
Well, what percentage of the legislature would you show that slideshow to, and then they still go, no way?
I don't know. Part of it depends on who we get in office this session. It really does. Because some parties don't listen to reason and some people don't pay attention to the statistics. So, the insurance lobby has a huge influence up there. But that doesn't matter. We still need to keep trying. We owe it to the people.
Sheila?
Well, along those lines, the insurance lobby does have a lot of power, and that's who we will be facing in trying to insure people. So how many, if we did actually implement this program, how many healthcare insurance workers are we going to be displacing, and how are we planning to replace those jobs for them? Because that's huge. That's a huge industry.
Yeah, can you say Reaganomics? Number one. Number two, there is a place for insurance. I focused on where we spend our money the wisest, prevention and primary care. There's a lot of other kind of coverage. Stuff that is not evidence-based, that is not a necessity. There is a market for the insurance company. People adjust, and they can move over and do other jobs. Many people work in jobs solely to keep their insurance. That hinders creativity and lifestyle and quality of life. So yeah, I agree with you, that's a problem, and that's why I said it's not going to happen tomorrow.
One of the things to remember is there are two basic plans being discussed. And one is the kind of a plan that former President Clinton put forward. And by the way, before him, former President Bush, George W. Bush's father, put forward a somewhat similar plan. He didn't put his shoulder behind the wheel. He just sent a proposal up to Capitol Hill and then quietly walked away from it. When Bill Clinton sent his proposal up, he really pushed hard for it. That's one type of plan. That keeps the insurance companies sort of in the game. They actually provide the insurance. The type of plan that Mary and many other people support and one of the bills that I got passed out of my committee is single payer, where the government, in effect you, become the insurance companies, and the insurance companies, for the purposes they now have with regard to their health care coverage, go away. They just go away. Now, there is a displacement factor in that, a job displacement factor. Bill Clinton didn't want to cause that displacement factor, and therefore he kept them in the game. So, you know, you have a choice.
But you know, I just want to say one more thing about this. We should maybe beat a dead horse, but there's so much to be said about that question. Now, if Franklin Roosevelt had said it's just impossible to pass socialized care for everybody over the age of 65, we would have never seen it happen. You know, if Lyndon Johnson would have said we could never pass civil rights legislation in the 1960s because there are just too many special interests in opposition, it would have never happened. If he'd have said we'd never be able to overcome the insurance company and doctor opposition, we wouldn't have universal health care for every senior citizen in America today. Now, what is the connection between those, among those incidents? The connection is leadership. It's somebody who says we can and we will. And whether it happens at the state level or at the federal level, it's going to take that kind of a commitment to say to everybody here, we're going to do this. And we're going to find a way to do it. It doesn't have to be the ideal immediately. That's my ideal, but it doesn't have to be that. We can get there in a lot of ways, but it's going to happen. But it's a function of leadership, and we need it badly in this country.
Yes. Oh, yeah.
I was just wondering, Senator Daschle, Congressman Williams, a lot of us in the room aren't going to be going to Washington, D.C. anytime soon, but I was wondering what advice you would have for us to light a fire under the ass of the people who are already out there.
Well, I would say three things. First of all, you're doing it tonight. I think this is terrific. You know, for you to be here and to be fired up about this issue really helps those of us who are in the fight every day. Just it energizes us. So keep doing this. Don't let that fire go out. And then secondly, I think it's very important to be asking your state legislators, so what are you going to do about this? Or to ask your congressmen or your senators, what are you going to do about this? I had a great conversation, and I know this isn't a political meeting, but I had a great conversation with John Tester. He's going to go to Washington, and he is going to do something about this. He promised me, and he committed already to begin working on this and make it happen for the state of Montana. That's the second thing. The third thing, and I think this is so important, the third thing is to try to triple this audience the next time you have a meeting like this. I'd love to come back to Montana someday and say, you know what, we've got a 2,000 room audience and there's standing room only. There are that many people that are concerned about this. We just have to ensure that young people in particular, young adults, understand what's at stake and turn out crowds even larger than this in the future.
Many of you may remember the name Cesar Chavez. Cesar Chavez, my on or off. Many of you may remember the name Cesar Chavez. Cesar Chavez started the Farm Workers of America's Union, the lettuce pickers and the grape pickers. And I had the opportunity to meet him one time, and I said, Cesar, how did you do it? And he said, well, I knocked on a door, and he said, I'm a lettuce picker like you. He said, I went to the barrio. I'm a lettuce picker like you, and I'm tired of working for $1 an hour, and maybe you and I ought to get together and organize something. And he said the first few doors turned me away, but finally I got to a door that said, okay, come on in. And then after I convinced the fellow in the house to help me with this, I told him I didn't have a place to stay, so they let me stay there. And then he said the next morning he and I went out together, he on one side of the street and me on the other. And he said, before I was done, I had 14,000 people going door to door with me. And we formed a union that changed the lives of migrant workers. Now, I'm not suggesting you all go out and go door to door, just half of you.
And forgive me for pointing, yes ma'am.
Me? Oh, okay, yeah. My brother, well, I'm from South Dakota, by the way, and I used to think that the Oglala Aquifer made
paint everybody bright pink because, you know, my parents worked for McGovern and also for, I went to junior high with her, Nikki Aberus. But anyway, both my brothers have been in the military for far too long, and I'm afraid to say my brother voted for John Thune. But he says he remembers both of you. He was once president of Young Democrats at SDSU, South Dakota State University. I also went there for a while. But what I was going to say is I'm a insulin-dependent diabetic. And I quit working after I got out of college because I had like severe panic disorder. Okay, I only thought I would be out of work for a few years, you know, and I had like terrible depression and stuff like this. And when I tried to go back to work, I had type 1 diabetes, and I can't get health insurance. And so here I am, I'm an extremely bright individual, and I'm sitting on the bench in life, and I'm sick of being poor. This ain't no great thing. I want to go back to work, but I can't because if I make $24,000 a year, which is pretty darn good in Missoula, Montana, I can't get any health insurance. I'd be paying my whole paycheck for health insurance because just like my father, that would be Kurt Floden. I don't know if you know the Flodens, but people out there do. Anybody who's 75 miles away, you know, is your next door neighbor. And I don't dare go back to work because I have type 1 diabetes. I can't get health insurance. And he was stuck in the same old dead-end job for years and years and years. And he was working as an engineer, and he was being paid as a salesman. What do you have to say about that?
Well, something I said at the beginning is something I feel very strongly about. This is far more than just a health issue, as important as the health aspects of all this is. This is truly an economic issue. One of the things that bothers me the most about what's going on in America today is that the economic disparity between the rich and the poor is a chasm today. It's getting worse and worse, and you're a statistic in that chasm. You're one of those people who are falling through the middle because we aren't providing the kind of basic benefits that every citizen in most industrialized countries in the world today take for granted. And for us, it's a gift. It's crazy. It's just absolutely crazy. We will never close that chasm until we have some form of national health insurance. So you don't have to worry about that the next time you apply for a job.
Mary?
Can you hear me?
Yes. Yeah.
Oh, okay. I think it's really interesting the point you bring up. In Montana and in many other states, they came up with a solution to the problem. That is, people who really need the protection of, really need access to health care, can't get it because the insurance companies, they don't want to cover you. They cherry pick the ones they want that are healthy, they're the cheapest to cover. So there's this one strategy, and this is why it's really important to pay attention to policy. One strategy is called a high-risk pool. So you take all the folks that are high risk and put them in a pool over here, and the government pays for them. And they provide some coverage for people who don't qualify, but you can't afford it. So in Montana, it's called MCHA. So you go and apply for insurance, and rather than the insurance, which should have a moral obligation to covering you, they now deny you care. So you go over here and you apply for MCHA, and they charge you 3 times as much. It's like an incentive for insurance companies to not do what they should do. And it was a solution that well-intended people came up with. These high-risk pools. Everybody needs to be in the same pool, sharing risk and sharing resources. You belong there.
Yeah.
This is a question for Raquel. Although I'm sure our two friends who spent time in Washington, D.C. have a good shot about this as well. Raquel, you mentioned malpractice, the stratospheric rise in the cost of that. We keep hearing that if we could just put caps on malpractice suits, malpractice settlements, you know, that'll just really control the cost of healthcare. I'm wondering if
I have some mixed feelings about that. I personally worked for a plaintiff's firm and worked as a litigation paralegal for a while. So I see the need to, when there are egregious and malicious and really negligent cases, that we shouldn't cap, and that we should allow our jury system and our justice system to determine what the damages are. My problem is with the malpractice insurance companies and the greed and what I've learned in my position, which is that they continue to raise those rates. In working with Larry Riley, what I learned is that we used to have 10 malpractice insurance companies available to physicians here in Montana. We are down to 3 companies. And so what's happened is that fewer and fewer companies across the whole United States are willing to provide malpractice insurance. And by concentrating that wealth, what they are doing is monopolizing and charging outrageous rates. And it is not fueled, and it is not a product of out of control litigation. It is a product of greed on the part of those malpractice insurance companies. That's my very simple answer, and I've studied it as much as I can. I have to say, in Montana we have some very talented people, and Larry Riley has worked on the legislative committee here in Montana, the interim committees that are studying the role of limiting malpractice. But we don't have in Montana a history of outrageous payouts or outrageous litigation awards. It's just not, we don't do that here. And so that's not the problem in Montana. The problem is that they continue to triple and quadruple, and we are not reimbursed at a rate where we can keep up with those rising costs of malpractice insurance in order to serve people. When the amount we get reimbursed from regular insurance companies, from Medicaid, Medicare, and the demand to serve people who have no insurance. We reduced our rates at Blue Mountain Clinic drastically so that folks can access health care. But we are a nonprofit, but we also have to be able to pay the bills and pay our employees and keep the lights on. And so, you can't operate without malpractice insurance.
That committee I chaired in the Congress asked, I think it was the Government Accounting Office, to run the numbers on the cost of malpractice insurance. And it came back, you could lower costs, if you got rid of all the malpractice suits and awards, you lower cost 1%, 1.5%. 1.5%. Now I know trial lawyers, I'm not a lawyer at all, but I know trial lawyers become a real bugaboo in this country, right? Because some people in this country need whipping boys. And they've decided trial lawyers are their whipping boys. Now you ask those poor bastards up in Libby who've got asbestos because of one company, whether or not they're glad that they have some trial lawyers out there trying to defend them against that monstrous company, W.R. Grace. Of course we need trial lawyers in America. Who else is going to face down the big boy?
One more statistic just to pile it on. I think it's, that on the average, every year, 300 million medical mistakes are made. Can you believe that? And 100,000 people a year die because of medical mistakes. Now, if you don't need somebody out there to protect you, then your thought of justice is different than mine. We've got to have some protection, and that's what Pat's talking about.
We have time for 2 more questions. We'll head to the back a little bit. Abe?
I've been hearing all these numbers about the number of people that are uninsured, and like tonight, where there was $11 million difference. One person said 26 million, one person said 47 million. Well, I did a little bit of research, and it's kind of tough. But it turns out that those at best are snapshots. That's on a given day. And it looks like that during the period of a year's time, at least 80 million people don't have insurance. And that's because they have pre-existing conditions when they get a new job.
Exactly.
They change jobs, and they lose some jobs before they get another. So we're not talking about 26 or 47 million. In a year's time, we're talking about 80 million, and maybe most of those insurance.
Absolutely. And then that doesn't even talk about the underinsured, those who have nominal insurance. But as Mary said, so many of those who are nominally insured have virtually no protection at all. But your point is well taken. I think permanently insured, uninsured people is numbers around 46, 47 million right now. And the partly uninsured throughout the year can be up as high as 80, 85 million.
He's right. I'm sorry, I gave you the wrong statistic. It wasn't 39 million, it's 46 million, but the way they calculate that is you have to be uninsured for the full year.
Right.
So if you have insurance for 1 month, you don't count as being uninsured. So you're right. He's right. I was right.
Last question.
I recognize you, Mary, for the one statement that it's profit over people, and that's one of the problems, that it's a marketing issue rather. It is part of the system. And Tom, you say it's an economic issue, but is it more of a policy issue as well? I mean, here we have pharmaceuticals and insurance companies bankrolling campaigns over at Capitol Hill, and I guess this goes to you and both Pat. I mean, this is more of a healthcare reform issue. It goes beyond that. It goes to policy. It does go to the people that we elect to represent our needs, and they're being padded by these companies to keep them in business. I mean, we could sit here and talk about ethics in the House and all of that, and it all comes up, and they say they're going to do something about it, and it just fizzles out the radar. It's like it's non-existent now. You don't have to deal with lobbying reform anymore, and that's a load of crap. So, I mean, where do we go from here? Like, how do we pressure that situation besides voting? I mean,
well, that's such a good question, and it's probably a good way to end this conversation. But just recently I had a meeting with some really profound national experts, and I expected them to sit down in front of me and lay out this statistical analysis of our healthcare problem. But you know what the first thing was they all wanted to talk about? They all said, we're not going to get this done until we pass meaningful campaign finance reform in this country. Absolutely. We've got to pass meaningful campaign finance reform. I hope they're wrong about that, but regardless whether they're wrong or right, you're absolutely right in saying that there's too much money in politics and too much money is affecting the way decisions are being made in Washington today, and that's wrong.
But look, your senators and representatives can make a difference on their own as well. When I took over the committee that had health care in front of it, I made a public announcement that I wouldn't take a penny of campaign money from any healthcare group, any nurse, any doctor, any medical researcher, no institutional money, no PAC healthcare money whatsoever. My staff, my campaign staff, got blue in the face because it meant that I had turned back, they tell me, $170,000 that would have come in for a chairman of a major healthcare committee. $170,000, and I was running for re-election that year. In the House you run every 2 years. So the truth is that yes, we need campaign finance reform. Tom Daschle was absolutely right about that, and by the way, against overwhelming opposition, did everything he could in the House of Representatives as the United States Senator and as the Senate Majority Leader to enact meaningful, real campaign finance reform in America. But again, there are forces out there didn't want to do it. But that doesn't mean that you can't talk to your senator and your representatives and say to them, stop taking the money from these pharmaceuticals, stop sending your staff to the pharmacy companies, stop this revolving door between you and the pharmacy companies, stop it, or I'm going to go door to door against you the next time you run. That's how you do it.
I'd like to thank everybody for being here tonight and thank the panel members as well for all the information. The one thing that I want to put out there to everybody in this room is a really interesting statistics. There's going to be 60 million eligible voters between the age of 18 and 29 in 2008. Young people do have a voice. Young people can make a difference. And the fact that you're here tonight just shows that you're interested. So take that next step and please, please sign up to be more active. Forward Montana is a new organization. We're interested in helping the young progressive voice of Montana make a difference in our state and make a difference in these issues. We have a table here for you if you would like to sign up. We also have other tables with other issues for you to become active. So please take the opportunity to do that before you leave. And again, thank you, everybody.